Hi everyone, this is Dr. Jayakrishna Reddy. I'm orthopedic consultant at Yashoda Hospitals, Secunderabad. I mainly practice joint replacements and sports medicine injuries, and I do a complex trauma too. So today I'm going to talk about the ACL ligament. ACL is Anterior Cruciate Ligament, which is in the knee joint. It's an important ligament to stabilize the knee joint by preventing the joint to forward slip off, and it gives rotational stability also. It's between the two bones in the knee joint, between the femur and tibia. And it's most commonly injured in sports people because of the contact injuries where knee is twisted, a screw hold mechanism happens where in such cases ACL ligament is injured. And in the initial stage, injury can be a small sprain, that's a stretch of the ligament, or complete tear. If there is a stretch of the ligament, initially you can wait and watch with rest and then exercises. With the rehabilitation, you can get back to your routine activities. In case if it is a tear, complete tear, then you have to undergo a surgery. Surgery is performed through a arthroscopy. That's we keep two holes in the knee joint and put a camera on one side and on instruments other end. We take your own tendon. It can be a hamstring tendon or quadriceps tendon or peroneus tendon, whichever suits you. After those tendon, we take it, we fix it in the joint with a screw or buttons either side. Or else we can use an artificial ligament also. It's called synthetic ligament. And post-operative, you have to do a proper exercises. First 1 month, you'll be doing strengthening exercise, isometric strengthening exercise, and range of movements. And second month, it's dynamic strengthening exercise, which exercises will be changed. And third month, we also include balancing exercises. Usually after post-operative, after 3 months, you can go back to slow jogging and fast walk. After 4 to 5 months, you can go back to your sports.
If you found this video useful, like, comment, and subscribe for more health updates.